Hello, I'm Dr. Dennis McKenna. Today I speak to you about the current state of our negotiations with the New York State Nurses Association. We have been negotiating with NYSNA since April 23rd. Since then, both parties agreed to more than 20 tentative agreements over 20 bargaining sessions. This is real progress. From the very beginning, we have followed our fundamental guiding principles of fairness to all employees, fiscal responsibility, and quality care. All contract provisions will be measured objectively towards fostering our mission, vision, and values. They drive our commitment to put patients first and to maintain our status as the leading healthcare institution in the region for them and for you. This contract must enable us to continue recruiting and retaining the best nurses while also being financially sound, so we can reinvest even more in you and the care you provide. There are generally three broad categories where there remain some differences on both sides of the table. During contract negotiations, especially after an initial contract ends, there is often some confusion about who holds which position. I want to push right through all of that, speak to you directly, and tell you exactly the offer we have put in front of NYSNA. I encourage you, if you would like more information, to speak to your manager. Staffing is a dynamic process influenced by any one or a combination of many different factors. They include patient acuity and hospital census. New York State recognizes this, which is why they require every hospital to submit a clinical staffing plan that is created and approved by a clinical staffing committee. We do this every year, and I am proud to say that this year the plan we submitted to the New York State Department of Health had the unanimous approval of the Albany Med Clinical Staffing Committee. This committee includes representatives from the bargaining unit. The plan we submitted puts patients first and reinforces our commitment to safe, quality patient care. The New York State Department of Health accepted that plan, and that is how we will staff the hospital. Workforce enhancements. Last year, we made significant adjustments to salaries to well over half of our workforce, above and beyond our annual merit program for all employees. We were proud to do that. We would very much like to do the same thing for our nurses. Albany Med has made significant proposals that would go into effect immediately once the contract is signed. Those proposals include hourly wage increases for nurses, increasing the starting rate for our newly licensed nurses, reinstating premium pay. In fact, we implemented this premium pay policy for non-bargaining unit staff last year and are eager to offer it to our nurses. Increasing the in-charge differential. Introducing preceptor pay. Adjustments to health premiums that remain below national averages. You can see details of these proposals on the screen, but again, this does not cover everything that we have put on the table. Union membership. The first contract with NYSNA maintained that membership in the union was entirely voluntary. It has always been my position that we would not require a nurse to pay dues as a condition of employment. That said, if any nurse wants to pay dues to the union, that is also entirely their choice. To me, this strikes the perfect balance, giving the individual nurse the option of whether or not they choose to pay dues. And if a nurse wishes to pay dues, we would make that process as easy as possible for them. That is what the first contract allowed, and our current proposal simply maintains that same commitment to choice. It should be pointed out, as was the case with the first contract, our position is that you would not be required to pay dues, but of course, you would still receive all of the pay increases and other benefits outlined in the proposal. There are many other things in the contract that I believe are also beneficial to our nurses, including increasing tuition reimbursement, increasing reimbursement for continuing education and advanced certifications, and uniforms paid for by Albany Med. This deal could be done this week. NYSNA is holding up this deal with their insistence that you must pay dues to them as a condition to work for Albany Med. I will not accept that because I firmly believe in your right to choose. Let me conclude where I began. The purpose of me talking to you today is to have a conversation directly with you, our nurses. The proposal we have currently in front of NYSNA is one that you deserve. I would very much like to give all of you all of those things in our proposal as soon as possible. You have earned them, including those significant changes to base salary, on the first pay after a vote on that proposal. There are many lawn signs around the area that has asked Albany Med to listen to its nurses. I believe we always have and always will. I also think it is true that in turn, NYSNA needs to listen to our nurses. This proposal positions Albany Med as a leader in the market for the recruitment and retention of nurses. It would go into effect as soon as it is signed. The decision is in your hands. Your opinion matters. You have a voice. I encourage you to use it. Talk to your managers. Talk to those that represent you at the bargaining table. And let's get this done so you will get your well-deserved pay increases immediately. And we can continue to focus on the things that are important to all of us, which is recruitment, retention, and caring for our community.